Namaste, welcome to my another video. Today I'll be talking about the COVID-19 and the global mental health. So let's begin. COVID-19. All we know about COVID-19 now, it's the pandemic that's threatening the world and growing in almost all the countries of the world, and this is the structure of the coronavirus. And as we see in this structure, we have a spike glycoprotein that is that helps in the attachment in the AC receptors of the body, of the lungs, and there is RNA and protein that's that helps in transcribing the genetic materials of the virus to the human body. And there's an envelope and hemagglutinin esterase dimer, HF dimer, that somewhat helps in the transcription and proliferation of the virus factory. And the symptoms of coronavirus, as we know that COVID-19 affects the human lungs mostly, and the primary organ to be affected is the lungs, and there are symptoms such as headache, cough, shortness of breath, and virus seems to start with a fever followed by dry cough, and after a week it leads to shortness of breath and needing for the hospitalization of the patients. But in some of the countries the virus is asymptomatic and the viral characters have been transmitted from one person to another without any symptoms, and and people who are not comorbid, they have less severity as compared to the comorbid people. And talking about the mental health, we all know that physical health and mental health, each both the aspects should be taken into consideration equally. WHO defines mental health as a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his and her community. That means no any stress. That means the stress that can be coped easily, day-to-day stress, that's normal stress. There is no anxiety disorders, and long-term emotional problems are not there. So mental health and physical health both should be taken into consideration, but in some developing countries only the physical health to prevent the symptoms of the disease is prioritized, but mental health lies in the shadow. And some of the mental disorders are mood disorders, eating disorders, anxiety, and psychotic disorders, personality disorders, cognitive and developmental disorders. So mental disorders are very prominent in people with COVID-19 and the lockdown of the country, quarantine, and everything. So mental health is very important. So the I would like to discuss about the predisposers for the mental disturbances. These are the COVID-19 fear of infection, deaths, as the virus is very deadly and fatal and it has no cure. There is a fear of infection, severity, and economic crisis, as the world is having an economic crisis, lockdown, and everything is shut down due to the virus. So it leads to economic crisis and it has impacted on the mental health too. Loss of employment, as I've already talked, lockdown, quarantine, and isolation. People are shut down at their homes, and there's no travel, though no recreational activities outdoors. People, they are very fed up with the recreational activities performing inside the homes, but how long? It would be very boring after a short period of time. So people, they are very mundane, and mixed news and fake and overhyped news and many more. Somewhat the social media are having an assault to an injury by circulating mixed news and fake and overhyped news without any reliable source, and people, they are believed to have response on that. So I have studied on many of the articles regarding the impact in mental health and some of the effect on frontline workers are in the study number one in Canada, uh, conducted in hospital staff. 29% of the hospital staff reported severe distress. The findings was 25%, 29% distress. And another cross-sectional survey in China, in hospital staff, they have 4.98 percentage and 3.47 percentage reported mild anxiety and depression. And in China hospital, 50% had depression, 44.6 had anxiety, and 34% had were insomniac, and 71% were distressed. In Pakistan, medical staff were reporting significant experience of confinement phenomena causing collective hysteria as a result of continuously working in isolated units of the hospital. And in Singapore, 14.5, 8.9, and 6.6 and 7.7% of the respondents screened positive for anxiety, depression, stress, and post-traumatic stress disorder, respectively. And non-medical staff showed a higher prevalence, 20%, than the medical staff, that is 10%. And again, in China, frontline health workers, more than 90% of the health workers were female nursing staff and were prone to mental health related problems. And a descriptive research about the frontline health workers in isolation uh, showed that the majority of health workers in isolation units and hospitals were not adequately trained in delivering quality mental health care. And a comprehensive study of 50 patients, 30% had 30 staff had been referred to a psychiatric hospital because of the strict quarantine, overcrowding, lack of knowledge among the mental health professionals, and difficulty to cooperate with patients suffering from COVID-19. And another cross-sectional study showed that 81% of the respondents in Singapore had new de novo PPE associated headaches waiting for more than 4 hours. And in Zimbabwe, study suspects and quarantine and isolation population had persistent psychological, mental, and social consequences. In India, a suicidal tendency and alcohol withdrawal syndrome were seen. In China, increased level of anxiety and stress associated with a low level of social capital, reduced sleep quality, and fear of disease causation was seen. And in China, psychiatric patients were further deteriorated in their mental health. And in Vietnam, lowered the health related quality of life. Depression was prominent, and it released the health related quality of life. In South Korea, uh, the people persisted 6.4 and 3.4% of quarantine patients had anxiety. Before and after quarantine, there was significant improvement in anxiety. And in China, isolated and quarantined children, they were 30% of them were vulnerable to PTSD and stress disorder, adjustment disorder. And among the quarantined public in China, young and student population were more prone to psychological and mental instability during the pandemic. And in infected cases, a soldier hung himself. There were suicidal cases in Delhi in India as he got tested and he was COVID-19 positive. He couldn't handle the stress, and he was a comorbid patient too. A study in Iran reported suicidal fear of death and depressive mentality of the infected cases, and in China, severe psychological problems such as high risk of suicide and aggression among the patients in the isolation were reported, and it forced the Chinese government to implement interventional programs related to mental health services. And previous studies showed that the victims of MERS, Middle East Respiratory Syndrome, detailing the psychological trauma because of being socially isolated even after being free from the disease, which led to some of the suicidal deaths among the adults. That is, social stigma was prominent in 2003 and 2004 after the epidemic. So this is a very serious case, and as being a citizen of Nepal, there are in cases in Nepal are 4,000 confirmed cases, and it's been increasing, and there is a deaths of 15 persons and 488 and increasing. People have recovered from the virus, and there is a serious case of the suicides among the lockdown period. That is, 1105 people have committed suicides from after the country was led to the lockdown since March 24 in different 7 provinces. Sudur Paschim province, Far West province, 115 cases was there, suicides. Karnali was 58, Gandaki Pradesh had 121. The maximum of Pradesh number 5, province 5 was 242, and province 2 it had 152, and province 1 had 186 cases of suicides. I I won't say that all of the suicides are due to the coronavirus and its stress coping disorders, but seeing the previous data from the Nepal police statistics, the suicides have increased much more, more than half of the suicides than the previous cases of suicides. That means uh, the virus is killing less people, but the mental health of the mentality and the stress of the virus is killing more than the virus itself. So the government is only primarily focusing for the treatment of the people and removal of the virus. People are being isolated, but the overshadowed mental health is overshadowed here. So the government should also increase the interventional programs, motivational programs for the people of the country, so that people are relieved and they get a ray of hope to stress with the cope to cope with the stress, and they do not commit such suicidal cases. The virus may go with the invention of the medicines shortly, but the impact of the mental health, that is seen, acute impact, we have already seen of 1105 people have committed suicides. This would have a very deep impact in the future as well. So the time has come to deal with the mental health aspects as well. Thank you for listening.